This recording will go over medication adverse effects, interactions, and contraindications, as well as individual considerations of med administration. In your ATI textbook, initially it starts off talking about the adverse medication effects in relation to the different systems, whether the central nervous system, the cardiovascular system, GI. At this point in time, we're going to skip this section of the textbook because we're going to talk about those as we encounter them throughout the lecture. So we're going to skip ahead to toxicity. So toxicity is an adverse medication effect that is considered severe and can be life-threatening. It can be caused by an excessive dose, but it can also occur at a therapeutic dose level. In terms of nursing actions, liver damage will occur with an acetaminophen overdose. There is a greater risk of liver damage with chronic alcohol use. The antidote, acetylcysteine, can be used to minimize liver damage. Hepatotoxicity. So hepat, you should think of liver when you see that. So toxicity of the liver can occur with many medications because the liver plays such an important role with metabolism. Because most medications are metabolized in the liver is particularly vulnerable to drug-induced injury. Damage to liver cells can impair metabolism of many medications, causing medication accumulation in the body and producing adverse effects and toxicity. Many medications can alter normal values of liver function tests with no obvious clinical indications of liver dysfunction. In terms of nursing actions, when two or more medications that are hepatotoxic are combined, the risk for liver damage is increased. Liver function tests are indicated when clients start a medication known to be hepatotoxic and periodically thereafter. Monitor clients for manifestations of hepatotoxicity, including nausea, vomiting, jaundice, which is yellowing of the skin, dark urine, abdominal discomfort, and anorexia. Advise clients to also monitor for these manifestations. Next, we'll talk about nephrotoxicity. When you see nephro, you should think kidney, so toxicity of the kidney. Can occur with a number of medications, but is primarily the result of certain antimicrobial agents and NSAIDs. Damage to the kidneys can interfere with medication excretion, leading to medication accumulation and adverse effects and possible toxicity. In regards to nursing actions, aminoglycosides can injure cells in the renal tubules of the kidneys. Monitor blood creatinine and BUN, as well as peak and trough medication levels for clients taking medications that are nephrotoxic. An allergic reaction occurs when an individual develops an immune response to a medication. The individual has been previously exposed to the medication and has developed antibodies. Allergic reactions range from minor to serious. Mild rashes and hives can be treated with diphenhydramine or Benadryl. Before administering any medications, obtain a complete medical history and also ask the patient about allergies. Angioedema is a serious allergic reaction that involves the lips, face, and oropharyngeal cavity. It causes swelling, and that can, if severe, can occlude the airway of the patient. NSAIDs and ACE inhibitors are the most common medications that can cause angioedema and can occur within 24 hours or any time thereafter. With angioedema, interventions are to apply oxygen, alleviate anxiety with reassurance, and, if needed, maintain an open airway with intubation or tracheostomy if laryngeal edema, stridor, or inability to swallow develops. Treatment with corticosteroids, diphenhydramine, which is Benadryl, or epinephrine depend on the severity of the client's condition. Monitor for reoccurrence of the angioedema when the medications that are being used to treat it wear off. Anaphylaxis is very important to know, a very severe condition. Anaphylaxis is a life-threatening, immediate systemic reaction caused from an allergic response to a medication, dye, food, insect bite, or sting. Allergic asthma also has a rapid onset with similar causes. Manifestations of anaphylaxis can start with anxiety, weakness, generalized itching and hives that progress to erythema and angioedema of the head and neck. Crackles, wheezing, decreased breath sounds, and a feeling of a lump in the throat, hoarseness, and stridor can develop into a life-threatening condition that results in respiratory failure, hypoxemia, hypotension, tachycardia, and death. Allergic asthma has similar manifestations that involve the pulmonary system that can become life-threatening. In regards to nursing actions, prevention and rapid intervention are vital to avoid a fatal outcome. If the allergy is known, the client should wear a medical alert bracelet. The client should have available at all times injectable epinephrine for their allergy. If the medication has medication that's being infused, we want to stop the medication infusion immediately. And if there is an antidote or antigen, we want to give that, and we want to notify the rapid response team. Or rather, we want to stop the medication immediately if that is the antigen or the thing causing the allergy. If there's an antidote, we can give that. We want to notify the rapid response team. Priorities: establish an airway to maintain ventilation. Administer bronchodilators that open up airways if needed. Treat with epinephrine. We'll talk about epinephrine as a medication in the near future. Treat with diphenhydramine or corticosteroids. Continue to administer oxygen. Obtain ABGs and plan for the client to receive inhaled bronchodilators or beta adrenergic agonists. Monitor hemodynamics. Watch for fluid overload from too rapid of IV fluid infusions and pulmonary status. All right, next we're going to skip to drug-to-drug interactions. So anytime a patient's taking more than one drug, there's a risk for those drugs interacting. And then the more drugs that the patient takes, the more risk there is for drug interactions. So normally with our elderly patients, they're usually taking a boatload of medications known as polypharmacy. And so they're at high risk for these drug interactions. And interactions can go either way. There can be increased effects, decreased effects, increased side effects, decreased side effects. So it just depends how these medications interact with each other. They could have increased serum levels leading to toxicity though. So the big thing we're worried about is patient safety when they're taking more than one medication. And we want to watch for toxicity. We want to understand how medications work together or if they're contraindicated to be given together, right? Because you as the nurse are the last safeguard for the patient. So the doctor has ordered something without realizing some sort of interaction. The pharmacist has filled it. Now you, the nurse, are the last safeguard to double check things and make sure this medication is safe to administer to your patient. Because if something that you don't catch, then it could have detrimental effects for the patient. We want to make sure we get a complete medication history from the patient. That includes OTC or over-the-counter medications. Many over-the-counter medications do interact with prescription medications. Advise clients to use caution and to check with the provider before using any over-the-counter preparations such as antacids, laxatives, decongestants, herbal supplements, or cough syrups. Antacids is a big one we'll talk about in the future. Antacids interfere with many medications, so clients are advised to take antacids 1 hour apart from other medications. Now we're going to move ahead to the lecture over individual considerations of medication administration. So this lecture starts out with factors affecting medication dosage and responses, includes body weight, age, gender, genetics, biorhythmic cycles, tolerance, accumulation, psychological factors, diet, and medical problems. And those are listed out to you with brief explanations in the textbook, and I'm going to let you refer to those on your own. The individual considerations and med administration chapter also talks about pharmacology in children, pharmacology and pregnant women, lactating women. We're going to not focus on children, pregnant women, and lactating women at this time. For our purposes, we're going to focus on pharmacology in older adults, which is considered patients who are 65 years of age and older. So older adults have physiologic changes. When you see that little triangle in documentations and whatnot, that indicates change. Older adults have physiological changes that affect pharmacokinetics, that affect how medications work in their body. Now, just in general, I want you to know, you see the majority of this list is pointing downward, decreasing. In general, when we talk about older adults and how their body's working, a general rule of thumb is everything's going to decrease or slow down or not work as well. So when you're trying to memorize how things change in the older adults, we've got two things that go up. Memorize those. Everything else goes down, slows down. So gastric pH increases and body fat increases. Everything else decreases. Decreased GI motility and gastric emptying time, which leads to a slower rate of absorption. Decreased blood flow. Decrease hepatic enzyme function. FX means function. Decrease kidney function and glomerular filtration rate. Decrease protein binding sites due to low serum albumin levels. Remember, albumin is that protein. And also decrease body water and lean body mass. Other factors affecting medication therapy for older adults: multiple or severe illness, impaired memory or altered mental status, changes in vision and hearing, decreased mobility and dexterity. So I can't read my pill bottle, my fingers don't work, my dexterity doesn't work to open my pill bottles. Poor adherence, inadequate supervision of long-term therapy, limited financial resources, and polypharmacy, which is taking several medications simultaneously. Nursing interventions to decrease the risk of adverse medication effects include obtaining a complete medical history, including all over-the-counter medications. Make sure med therapy starts at lowest possible dosage. Assess and monitor for therapeutic and adverse effects. Monitor plasma medication levels to provide a rational basis for dosage adjustment. So that's like our peak and troughs and the therapeutic levels that we're looking at. Assess and monitor for medication to medication and medication food interactions. Document all findings and notify the provider of adverse effects. To promote adherence of older adults or make sure they're taking the medications the way they're supposed to, we want to make sure we give clear and concise instructions, both verbally and then written, that they can refer to at a later time. Ensure dosage form is appropriate. If a patient has a difficult time swallowing, maybe a liquid medication would be better than an actual pill. Provide clearly marked containers that are easily to open. A lot of times when you get a medication from the pharmacy, depending on which way you put the lid down, will be whether the cap is childproof or not. Assist the client with setting up a daily calendar with the use of pill containers. Discuss the ability of and access to local resources for obtaining and paying for medications. Suggest the client obtain assistance from friends, neighbors, or relatives, and advise clients to dispose of medication they are no longer taking or those that have expired in a proper manner.